The rotator cuff is vulnerable. It doesn't have a great blood supply, and so without maintaining rotator cuff health, including exercise, the rotator cuff can break down and become injured and ultimately lead to significant shoulder dysfunction, which also leads to the development of arthritis within the shoulder. Today we're going to talk about the shoulder. The primary problem with shoulders, aside from arthritis, which is a problem unto itself, is rotator cuff pathology. There are 4 rotator cuff muscles that hold the humerus, the head of the top of the arm bone, in place, keeping it close to the cup or the glenoid. And when these muscles are injured or tear, it can lead to pain and dysfunction. So that's somewhat of a chicken versus the egg question, because you can have an acute injury to the rotator cuff muscles, and without repair, that can lead to abnormal movement within the glenoid fossa, where the arm bone moves abnormally and you develop arthritis. Alternatively, you can be an older person who has lots of arthritis, and because your arm bone doesn't move properly in the glenoid, you can develop rotator cuff tears because the muscles aren't strong enough to move the arm bone in the glenoid. So the standard treatment is exercise for the smaller tears. They can be moderate-sized partial thickness tears, and taking non-steroidal anti-inflammatory medications and going to physical therapy. And these tears can get better, function can be restored, particularly for partial thickness tears, over the course of time. And the rotator cuff exercises that are commonly done, whether you have a partial thickness tear or even a full thickness tear, are exercises where you do range of motion to maintain and prevent developing what's called a frozen shoulder, and exercises such as Codman exercises, where you use a pendulum back and forth and in circles. If you wind up going to physical therapy, they will try to restore your range of motion in the shoulder, because most times if you've torn your rotator cuff, you will have lost range of motion and have difficulty elevating your hand above shoulder level. Once they've worked on restoring your range of motion, and they can do this with passive exercises or active exercises where you walk your fingers up the wall or use some type of pulley contraption to get your range of motion back, where one hand is pulling down over a pulley that can be attached to the door, and the other hand is the rotator cuff tear that you pull up and try to restore movement. Once you get passive movement back, then you work on active movement, where you're doing the work yourself to get a motion back. And once you can do that with no resistance, then your therapist typically will add resistance exercises in to strengthen the rotator cuff muscles and see if full function can be restored. In the case of a severe rotator cuff tear, the risk is that if there's a separation of 1.5 centimeters or more, the rotator cuff will start to retract, and it becomes difficult even for surgery arthroscopically to sew that muscle up and pull it to the head of the humerus and anchor it in the bone. The surgery itself takes months of therapy after the procedure. Usually the patient is in what's called an airplane split, where their arm is out to the side, and they're strapped in with a foam cushion. And after 6 weeks, really the therapy begins. And you can be in therapy for a period of 6 months or longer. And even with surgery, there's a re-tear rate of about 33%. So it's not a perfect surgery, and sometimes it has to be done again. If you can't repair the rotator cuff or it continues to re-tear, then you're looking at a shoulder replacement surgery, which is a pretty big deal. If you have small to moderate sized partial thickness tears, we can put your platelet-rich plasma into the tear and help reduce your pain, improve your function, and get you back to where you were previously. That's the goal. If your tear is larger than that and is a full thickness tear, up to 1.5 centimeters, which is almost 2/3 of an inch, we can put in bone marrow aspirate to help improve the function and get you back to reduction in pain, ideally in conjunction with physical therapy. The good news is that the treatments work pretty well. Most people respond very nicely to the treatment, and with therapy, 1 to 3 months, and generally wearing a sling for 7 days, you start to improve much quicker than if you were to have surgery. So that's really a good thing, and we can help many people.